I'm Andy Orm of O'Reilly Media, and I'm talking at the Strata Rx conference with Brad Miller of the Square 6 Group, a consulting firm that helps healthcare companies deal with their data issues. Yep. And we were talking about the keynotes this morning and how they have these wonderful ideas about involving data, like Tina Brown Stevenson said that the largest insurance company in the country has ways of finding out whether someone's likely to get diabetes 2 years in advance. But then you told me, why isn't this stuff being used already? So that's the question. Why isn't it?
Yeah, I think it's a fantastic question. I mean, I come from a clinical background as well, and I've attended a number of these conferences over the past couple of years, and you see a lot of innovation being talked about, and I think it's all fantastic to push that forward, but you very rarely see it pushed into clinical practice or actually put into the real world or on a very broad scale. And I think quite often what we end up running into are either business or financial disincentives to actually use the data or to engage with patients the right way. And so it's not just simply enough to bring the data together in a meaningful way. That's part of the table stakes, but we also need to bring about more reform and or align that data with the actual business interests of the providers and the payers to actually put it into real use.
What's a project you worked on where you made the change and you brought the business to a new way of doing things?
Sure. So I'm working with the health system, Christianacare in Delaware, where we actually received a Medicare/Medicaid innovations grant to put in a big data layer to actually aggregate all of the patient data from the health system and across the state, where we are actually in the process of mapping that to a patient relation management tool so that would allow nurses and care managers and health coaches to actually interact with their patients in a meaningful way, so that eventually for heart attack patients, instead of today being discharged from the hospital and sort of sent on their way, we'll be able to monitor and follow them for the first year for their post follow-up. And the goal is to ultimately end or to reduce the number of 30-day readmissions, which is sort of one of the negative metrics that CMS has.
Yeah, you're going to be penalized for these 30-day
Absolutely.
readmissions.
It's going to become a very, very big deal.
Try to push it off to 31 days.
Right, and it came up, and I mean this in a very, very good way, is that when we were writing the grant, it became very clear that as we were preventing diseases or illnesses or readmissions, that actually is also taking away from the health system's bottom line. And I think that's a very real problem that needs to be tackled. And I don't think that it's necessarily bad for health systems to point that out, although it's somewhat of a, seen as a negative today. But I think that it's an actual reality, and some of these issues are standing in the way of actually utilizing big data and some of the innovations that we're seeing today and actually moving them into practice.
So did the organization find a way to change incentives?
I think that's what this program is actually all about, which is fantastic, and I'm glad to see that CMS is actually investing in a program where they're going to bring the financial data together with the clinical data and really begin to understand not only the number of illnesses that are prevented or the readmissions that are prevented, but then also who those benefits accrue to, so that then they can either be reimbursed or the care can be managed in the appropriate way.
So because CMS saves some money, the Medicare saves some money, they can then disperse funds to the institutions that saved the money.
Correct. And then hopefully down the line that other payers and other health systems follow suit, and so that there's actually a model that we can adhere to and actually real world evidence showing how this actually works.
How do you deal with a patient after discharge? Would it be like email, telephone, visit?
Yeah, so in the case of this program, what we're actually doing is taking a pretty advanced the algorithm and the analytics that we're doing in patients. So we see them on day 2 of hospitalization, and actually run them through both questions about their current illness and their state, and then also match that up with their clinical data. And we say, okay, this is a very severe 75-year-old man who's got heart failure. We need to really stay close on these patients so they reach at a higher level of care, so they receive many more follow-ups and much more in-home care. Whereas if we have a 51-year-old who had a wake-up heart attack, let's call it, something where it's an event they weren't expecting and they're kind of shocked to their core, but they don't really have other comorbidities, other illnesses associated with their heart disease, we can actually get them into cardiac rehab and make sure that they're followed up with the right physicians to make sure that they stay healthy for the rest of their life. And so we're actually utilizing that data to triage them in terms of the type of care that they get, so the amount of resources that are allocated from the health system, so that we can actually give them the appropriate level of care to keep the very, very sick from becoming any more sick, and we can actually take the ones who have less of major illness and actually who had a major event but can actually get better over time and hopefully prevent costs down the line.
There's a lot more that we could say, but I think we should wrap it up because we want to keep these videos short. Do you have anything else to say on this subject?
No, I think one of the main things that I'd like to see out of a lot of these innovations too is to also look back at more simple use cases and be able to think about how do we actually apply data in the real world and actually get clinicians to engage with it. And some of the more successful programs that I've seen, both federal initiatives and other healthcare systems, the more simple that we tend to be. We tend to get very complicated in terms of how we think about data. I think how we actually use it and the data that we use can actually be simplified greatly.
Thanks, Brad.
Yep. Thank you, Andy.
Good to talk to you.